Hi, this is Claudienzi here at the 2011 American College of Cardiology meeting discussing the late-breaking clinical trials for the segment on theheart.org called Trials and PIs. Delighted to have so many of the PIs available to come and discuss their late-breaking data. And once again, we have the privilege of having a PI of the study known as the NAGOYA HEART Study. This is Dr. Murohara. Dr. Murohara is from the Nagoya University School of Medicine, Nagoya, Japan. Thank you so much for being with us. We really appreciate your presence.
Thank you very much.
Now, to set this up, this is a study done in hypertensive patients who happen to have glucose intolerance, a very important patient population and one in whom we're not exactly certain not only what is the best treatment for high blood pressure, but how aggressively should we treat their high blood pressure. So clearly we need more information, and these investigators that did the Nagoya Heart Study attempted to pursue this question and did so in a very deliberate and appropriate fashion. We would like to kind of start this discussion by setting the background, what really prompted you, and then after going through that, tell us about the patient population and the protocol.
Okay, as you know that hypertensive patients is often complicated by diabetes or impaired glucose tolerance,
Yes.
IGT. If the diabetes and the hypertension combine, the cardiovascular risk is more increased as compared to the either hypertension or diabetes alone. Many studies previously show that angiotensin converting enzyme inhibitors, ACE inhibitors, or angiotensin receptor blockers, ARBs, can reduce the new onset of type 2 diabetes and also slow down the nephrotic complication of diabetic patients. So that many guidelines, including American, European, or Japanese guidelines for treatment of hypertensive patients, recommend either ACE inhibitors or ARBs as a first-line medication for diabetic hypertensive patients. But in some studies like IDNT, this is the irbesartan nephrotic diabetic nephropathy trial, show that calcium channel blockers are almost equal to ARB to prevent the major cardiovascular events. And even in we look into myocardial infarction or stroke, although it's insignificant, calcium channel blocker is more, superior to ARB. This is a very significant effect by CCB. So we thought that the calcium channel blockers are also very important for diabetic hypertensive patients. So we studied the trial comparing the ARB versus calcium channel blockers in Japanese hypertensive patients with diabetes or IGT.
So how many patients did you enroll?
Actually, we first thought that we like to recruit almost 3,000 patients, but finally we could recruit about 1,150 patients.
Okay, so about half were on valsartan and half were on amlodipine. Were they also on diuretics? What else was necessary to control their blood pressure?
Yes, our goal of blood pressure control was 130/80 because there's many guidelines recommend this level of blood pressure for diabetic hypertensive patients. So that's one arm is amlodipine and one arm is valsartan. If we are necessary to reach to a 130/80, you need to add to either diuretics or beta blockers.
And what were the entry blood pressure recordings? Coming into the trial, what was the baseline blood pressure?
Baseline about 145/, something like 85.
Okay. So tell us about the results.
Yes, actually, the primary endpoint was composite of major cardiovascular events. That include myocardial infarction, stroke, revascularization, and the mission due to heart failure and sudden cardiac death. And we couldn't find any difference between valsartan and amlodipine in terms of major cardiovascular composite event.
So do you think it's because the two treatments are similar, or do you think your study was underpowered?
I think one is limitation of one of our study is the the recruited number is too small, and also event rate was small in our country. That's most of the studies coming out from Japan. The event rate for cardiovascular disease is quite low as compared to the Western countries. That's one limitation study. Another thing is, as you look into the study like a value trial,
Yes.
you could not find any difference between the valsartan and amlodipine. So actually, this is a kind of a repeat of such type of clinical trials.
Why do you think you couldn't get the 3,000 patients you were seeking?
Actually, it's a little bit difficult for us to include patients, and it took a longer time if we try to increase up to 3,000.
So what do you think is the take-home message for this study, the Nagoya Heart Study?
Okay, actually, if you look into each component of a composite endpoint, only in heart failure, the ARB valsartan was superior to CCB and amlodipine. So this is also an echo of the results of IDNT. In that case, irbesartan was superior to amlodipine to prevent heart failure in patients with diabetic hypertension. So this again, we confirm the results of the IDNT or value trial in our Japanese population. So, so that's our result support the current guidelines for hypertensive treatments, especially patients complicated with diabetes or IGT.
Dr. Murohara, I want to thank you.
Thank you very
Congratulate
much.
you for completing your Nagoya Heart Study. I know it was a challenging study to do. I think the take-home message, in addition to the points that you've already made, is that we need to continue to work hard to understand how best to treat patients who have hypertension and diabetes.
Yes.
The most important thing is appropriate blood pressure control, probably by whatever strategy is available, just getting the blood pressure to about 130/80, and then providing all the other treatments that are appropriate for the diabetic patient, including looking at other comorbidities and having a high index of suspicion for underlying cardiovascular disease. This continues to be a challenging patient population, but these kinds of studies will help us obtain clarity at some point in the future. Again, Clyde Yancey here at the 2011 American College of Cardiology late-breaking clinical trials discussions on theheart.org in the segment known as Trials and PIs. I hope this information has been informative. Thank you for your attention.